You might be sitting here thinking, particularly if you're pregnant still, I don't know anything about babies and I won't know if my baby is well or not. But I can assure you, you will. Within the first week of your baby's life, you will be the expert in your baby, not the midwife, not the doctor, you, your baby's parents. You're living with them 24/7, therefore you will pick up if something is not quite right with them really, really quickly. So the sort of things that we're talking about would be their colour. So hopefully I'm looking nice and pink and healthy today. If I was unwell, I would be pale, a bit peaky. It's the same for babies. Also tone. So babies are born with good tone in their arms and legs, in their limbs. And if you notice that they're a bit floppy, then again, that can be a sign that they are unwell. We can also look at what they're drinking. So how much are they taking? Are they taking their normal amounts? And also their nappies. So what's coming out? Are they peeing regularly? Are they pooing regularly? Again, these are signs that they are well. So any changes in those you will notice quickly. The other thing to think about is temperature. So a normal temperature for a baby is the same as an adult, so anywhere from 36.5 to 37.5. If there's a change in their temperature, again, that can be a sign that they are unwell. If you were to notice that any of those things were changing, that would be a reason to give your GP a call and just ask for some advice. So never sit at home just thinking, or not quite sure what's wrong, I can't quite pinpoint it, but I don't want to bother them. Just make that call. And again, with GPs, we've all had experiences as an adult where we might have to wait a long time for an appointment, but as soon as you mention a baby, they will find a time to see you very quickly. You'll get a chance to speak to the GP, and if they feel it's appropriate, they'll invite you down to the surgery, or they might even advise you to go into A&E. A&E for babies is much more accessible, so we use it much more readily than we do with adults. So never be afraid to take your baby to A&E if that's the advice that you're getting. The other resource that we have is 111. So if it's the middle of the night or the weekend, you can call 111. They also have an online service and they can guide you as to the most appropriate care for your baby. So the message is, don't sit at home and worry. If you're unsure, if anything's just not quite right, you've got an instinct that something's off, but you can't quite pinpoint it, just make that call and get some reassurance and advice from a medical professional.